My name is Fred Wagner. I came in about 4 or 5 months ago to Posture Perfect. Had a severe, low back pain, a lot of shoulder pain. So much where it was hard for me to sleep, hard for me to operate, just on a day-to-day basis. Kept me from doing a lot of things I like doing, baseball and golf. So I decided one day, it's like I can't take this pain anymore. So I called. I made an appointment. That's when I met Dr. Scott, and we figured out where the problem was. It was really bad. It was a source of most of my pain was the lower back. Everything was not working right. It got me on a treatment plan. Got me pretty much back into shape or better shape. But ever since then, it's been better since day one. 4 or 5 months later, I can actually move my back. Shoulder's been a lot better than the first day. It's just just looking ahead every day. Everything's getting better.
Okay, so when Fred first came to the clinic, what we found in his examination and x-ray was that he had severe disc degeneration in his last lumbar segment, the L5S1 disc. This was causing a lot of pressure on that nerve. So when he was doing an activity such as golf, where you're doing a one-sided repetitive activity, or even baseball, he's a pitcher as well. So he's doing that left twist over and over again. Caused a lot of wear and tear in his pelvic as well as lumbar spine. So we wanted to get him out of pain, of course, that's our first concern. But to get him out of pain, we actually have to find the cause, and we found that. So, after a week, after even one treatment, his pain levels went way down. However, we had to do the work to actually correct some of that disc misalignment. So over time, we implemented chiropractic adjustments with therapeutic exercises, specifically focused for low back. After a couple months, he was playing golf 5 times a week, maybe even 3 months later, without pain. Every now and then he would have an exacerbation, but he recovered much quicker from it. So it was really the strengthening around our corrections that did a lot of the work. And Fred was able to maintain those exercises on his own. We also were able to find his nutrition was actually a pro-inflammatory type of diet. He's just eating a lot of processed food, junk food, carbohydrates, cause inflammation in the body. So we actually got him on some anti-inflammatory supplements, as well as corrected his diet, and that has helped him actually lose some weight, which is not what he initially came in for, but that was a nice bonus. So now we're at the point where Fred is coming in for maintenance for his low back, and we're now working more on shoulder stability so that he can get back into baseball without concern of injury for his shoulder.